Hello and welcome back to the channel. Today I'm going to be talking about some of the things I've learned during my second year in my physiotherapy course in the University of the West of England in Bristol. So in second year, the course focuses on three main aspects: cardiorespiratory, neurological, and musculoskeletal. And I'm going to be talking about each of them in detail respectively. So in the first year of respiratory physiotherapy, we looked at some of the respiratory diseases that occur in the lungs. But now in second year, we're going to be looking at diseases that occur more on the heart. So some of the examples of cardiorespiratory diseases that we looked at are coronary heart disease, atherosclerosis, left-sided and right-sided heart failure. We also had a deep look at how the mechanism of blood pressure works in the human body when a person encounters different situations. We also looked at different forms of exercises that we can prescribe for patients that are suffering from cardiorespiratory diseases, and the methods that we can do to progressively overload the exercise intensity for patients that are doing the exercise training. This involves looking in the mechanism of how the muscle energy systems in the human body works, as well as thinking of different considerations when designing an exercise program for cardiorespiratory patients. So in neurological physiotherapy, we revisited some of the pathologies of the neurological diseases that we have looked at during our first year, such as stroke and Parkinson's, and presentation of patients that have had those neurological diseases. But the main focus is interpreting the neurological disease that the patient has based on what the patient displays. We also have a look at some of the different outcome measures that we can use to evaluate the severity of a patient's neurological disease. And we also use different pieces of research that have been done in the past to evaluate the effectiveness of each outcome measure that are used. We also focus on exercise prescription for patients with neurological diseases, but then the exercise that we prescribe can be very functional, simple, and practical to patients' daily activities. They can be real-life movements that patients normally encounter in their daily lives, such as manipulating different types of eating utensils and reaching and grasping objects from the top shelf. So what the exercise prescription does is that hopefully it directly translates into improving the independence and quality of life of a patient's surroundings and the patient being in their home environment. So in musculoskeletal physiotherapy, we kind of looked in depth in the pain concept. We kind of looked at examples of different types of pain, such as referred pain, somatic pain, radicular pain, and radiculopathy. We also had a look in the evolution of how humans respond to pain over time, starting from the old days of BC to the modern era, and also looking at how our response to pain changes throughout various pain models, and this was quite an eye-opener to me. We also look at some of the typical musculoskeletal problems that patients normally face, such as in the cervical, thoracic, and lumbar spine. We also look at pelvic health and also spinal dysfunction, which is only some of the examples that we have looked at. And we also had a look in some of the treatment modalities that we can use in MSK practice for the problems that we have looked at listed above. So I'm going to just list some of the examples, such as trigger point therapy, TENS, which is called transcutaneous electrical nerve stimulation. We were also trained to design an exercise prescription for these MSK problems, and we have to justify the dosage and the duration of these exercises that we give to these patients. Also, some of the treatment methods that we learn for MSK practice is not applicable at all times. Therefore, we need to understand at what situations we're not able to use these types of treatments, which are called red flags. Even though that we've learned a lot of knowledge throughout the cardiorespiratory, neurological, and MSK modules, one major skill that we've learned about the second year is clinical reasoning. This is a process where a physiotherapist make informed decisions about diagnosis and treatment based on analyzing information from patient assessment. This involves applying theory and experiences from practice to determine the most effective strategies that can be used. It also considers a wide range of factors such as past medical history, a social history, a drug history of the patient, as well as aggravating factors and easing factors. Overall, it's very important to develop comprehensive treatment plans that are evidence-based from assessment and tailor it to patient-specific needs. Alright, so that concludes my second year of my physiotherapy course in UWE. Thank you very much for watching. If you like the content of the channel, please do like, comment, and subscribe to the channel, and share this video to your family and friends. Thank you for watching, take care, and I'll see you in the next video. Peace.